Good afternoon. Thank you for watching our Westminster Canterbury weekly program for Thursday, May 20th. Today, I have a couple of topics that I want to talk to you about, and then Jess Goldberg, from Courtesy Services is going to share some exciting news about some changes that are coming to the way we manage all the thousands of packages that come on campus for residents. And so she'll share some of that information, and then we're going to wrap up today with Vanessa, who has our Pastoral Care segment. Quickly, a little bit of a COVID update. On Monday, we announced changes to our masking guidance that's in line with the Centers for Disease Control and Prevention and the guidance they put out in terms of needing for fully vaccinated individuals that are residing or in non-healthcare settings, being able to take their masks off. And so it's really good to see everybody out and about in independent living. Certainly some with their masks, but many without, and that's it's a really good thing to see everybody. Staff will continue to wear masks. I'll talk about that in a minute. But here's, just to recap, here's what we shared in the memo that we sent out on Monday. Mary Morton Parsons Health Center, our assisted living levels of care, Avalon, Monticello, and Gables, and our rehab department are all considered healthcare settings as defined by the CDC and Virginia Department of Health. And so masks are required for anyone in those visiting in those areas or working in those areas. Fully vaccinated independent living residents and outside visitors may choose whether to wear masks in public settings around our community. While we are not going to require proof of vaccination, we ask that each individual and each family please take the personal responsibility to be honest about your vaccination status and choosing whether or whether or not to wear a mask. We're certainly getting some questions from families or from residents who are expecting to host some families where part of the family's vaccinated, part of the family isn't vaccinated. I think the prudent thing to do is to wear a mask if you're going to be close. If you're going to be socially distanced, it's probably fine. And residents who are fully vaccinated, your risks are low, very low, but there is still some risk. So you're going to need to take personal responsibility for those decisions and keep yourself and your neighbors safe. Certainly, we're seeing it on campus. Some who are fully vaccinated are choosing to continue to wear masks in public and out and about around campus, and that's perfectly fine too. We're seeing that out in the community where retailers and establishments have taken down their mask requirements, but still many people in those establishments are wearing them. And so it's entirely up to you, and you do what's comfortable. It is perfectly okay to continue to wear it if it makes you feel comfortable. Now, as I said, all of our employees, all of our contractors are required to continue to wear masks everywhere on campus, with the caveat about outdoors, and I'll talk about that in a minute. We are going to continue to monitor the local positivity rates, which are at or about 4% and headed down, and that's really good news. Vaccination rates, both on a broader societal scale and here at Westminster Canterbury, where we're continuing to see it improve a little bit each day, and so that's good news. And then we're going to watch the latest guidance and take our direction from the guidance. When it comes to masking outdoors, employees and contractors who are working outside, we are going to allow them to remove their masks so long as they're not near anyone, residents or visitors or anyone else. We're going to ask that they don a mask as soon as someone, a resident or a visitor or anyone else is near them. But if they can maintain their distance, if they're landscaping or working outside and they can keep their distance from residents and guests, we're going to allow them to take their masks off. As you all know, it's very uncomfortable outside when it's warm wearing these masks. So for staff, we're going to allow that. But inside the building, all staff continue to have to wear masks. So screening is another topic. A lot of residents have been asking about this. I'm certain staff are asking about it as well. Screening at the Avalon entrance is still required for all employees and all visitors coming into Westminster Canterbury. And all that screening continues to happen at the Avalon entrance. We're not screening visitors or staff at the CDC entrance anymore. That's just children and their parents. We are required by regulation to screen everyone, 100% of everyone who enters into the Parsons Health Center and into our assisted living levels of care. And so, thus essentially, we need to screen everyone, employees and visitors, because it's the only way we can assure ourselves that we're going to stay in compliance with screening everyone who enters. There's just too many ways to get into healthcare and assisted living without getting screened if we don't push everyone through the screening and get everyone to wear a band that's been screened. So for now, that's going to be our process. Our compliance of achieving 100% screening is required, and it's really not negotiable. We expect this will change, like everything else, as the conditions improve, and they are improving. We expect we're going to get some improved guidance from the Centers for Medicare and Medicaid Service, and subsequently from the Virginia Department of Health, but it hasn't happened yet, and so we need to continue to hold the line. I recognize, and I've certainly heard it from some residents, in independent living, that might be frustrating for your visitors, especially those that are here every day, but it is required, and our compliance with that regulation is important. It isn't something we can take lightly. So thank you for that. I appreciate everybody's compliance. Changing the subject a little bit, this week the clinic has seen a few residents presenting with symptoms similar to COVID, fever, achiness, tiredness, those sorts of symptoms. So we want to ask you to please remember, while you don't have to wear a mask outside the Parsons Health Center, assisted living and rehab, if you're having any symptoms, whether that be a fever, a headache, respiratory, flu-like symptoms, anything, please don a mask. And if you're going to come to the clinic, please, because of feeling symptoms, please wear your mask, just for everybody's safety, just in case. It's most likely not COVID, but we don't want to take any chances. So we appreciate everybody's help with that. The clinic would also like to remind you to take care of your COVID-19 vaccine card, that record that you were given when you got vaccinated, because the clinic has a very limited supply of those, and we're not sure we'll be able to get more. If you're worried about losing your vaccination card, your record, you can do what most of us have done, which is make a photocopy of it and carry the photocopy, not the card, or take a photo of the card with your phone and keep that on your phone so you have a record of it if you need to show it to someone. But put that card away and keep it safe because you're a physician. If you're planning to travel and for lots of other reasons, you're going to want that in the future, most likely. We are working on a number of additional changes to programs and services that will put us in line with the governor's changing guidelines that go into effect on May 28th. If you didn't see it, that was the date that the governor put out there for changing a lot of the social distancing rules and a lot of this other stuff. So next week, we will share a good number of details about how those changes as of May 28th and then what follows on behind that will come. So look forward to that next Thursday. Now I want to change subject completely and talk about the Vibrancy Project. In today's edition of the Westminster Canterbury Tales, we shared some details about the upcoming Vibrancy Project and some of the other projects that will begin here in June. Today I want to share an overview of one of the elements of construction that will be happening this summer, and that's our new parking deck, which, as you can see on this slide, is coming to the location of the current Parsons Health Center parking lot next to the Child Development Center. There's a couple other areas you can see on that slide where projects coming as well, and I'll talk about those. But The parking deck that I mentioned will feature parking for approximately 400 staff, PHC and assisted living visitors, and contractor vehicles. The parking deck will have 5 levels of parking, elevator access, and there will be 2 electric car charge stations on the lowest level, the ground level of the garage. And then we will rough-in wire the electrical for 2 additional charging stations on each of the upper 3 levels. Our team here at Westminster Canterbury, in coordination with our design team, has evaluated several different car charging types, different configurations and systems for inclusion into the Vibrancy project. And they'll be going in this garage, they'll be going into the other buildings in their garages, and we will be adding additional charging stations around campus for residents and current residents and their guests with electric vehicles in the near future. Those locations are being worked out right now, and then we'll get them in. Hopefully this summer we'll see those new charging stations coming in for existing residents and their guests. In addition to the spaces within the parking deck, I said about 400 inside the deck, there will be an additional 50 or so ground level parking spaces around the parking structure for handicap access, short-term drop-off, and some guest vehicles. The parking deck construction documents that are in process right now will be completed by June 1st. Construction will begin in July with the goal to have this structure finished and in use by near the end of November, right around the Thanksgiving timeframe is what we're shooting for. Now that all depends on the weather and that sort of thing, but it should be done by the end of November, early December. The design is for it to be a precast concrete fabrication, which means this structure is being built in large components in Petersburg, and it will be delivered in large sections, and all that shortens the construction window down to 4 to 5 months. First thing they'll do is the foundation work, and then the big components will come in and it'll get put together. Because the Parsons lot will be closing for construction, a temporary employee parking area will be constructed on the former Azalea Mall portion of the site, immediately adjacent to where the existing employee lot is by the pond, just on the other side of the fence, which is existing old parking lot. We're going to build a new parking area where we can put all the cars that are currently parking in the Parsons lot there, and there'll be a walk path from that lot over to the sidewalk. So it's right next to our existing employee lot. We should see that get laid out and fenced, and some temporary lighting and security measures in June, hopefully. So June timeframe is when that would happen. Also in June, we're going to see the preparation for the promenade renovation. Thus, portions of the ellipse will be fenced off and cleared. Part of that is the trees at the back of the ellipse. So on June 2nd, 3rd, and 4th will be the time frame when the removal of the willow oak at the back of the ellipse and the other trees along that edge of the ellipse will be removed. As Kathleen Pender has shared with you last month, there are plans for repurposing all that wood from the willow oak and some of the others, a couple of willow oaks out there, into some furniture within the promenade area, the new renovation of the promenade, and some other projects. The team of arborists and the Vibrancy construction team have told us we need to do this now in terms of removing this tree to repurpose that wood, because the drying time for a tree like that will require 2 full years before we can use it to make some furniture for the promenade. So we're going to take those trees down, make it a safe construction access area, and then we'll see that the harvested wood from that come back as some of the elements within the new promenade spaces. You're seeing an image that shows really the affected sites from construction that will happen later this year, throughout the rest of this year. The first is Zone A, which is where the current resident gardens are. That area is going to be a construction zone because that's where the construction team from a parking deck needs to locate their crane as they construct that parking deck. There's really no other place for the crane to be set up, so that's where that needs to go. So that area will be cleared and fenced for a crane. Section B, which is where currently the temporary garden boxes are on the ellipse, that area will remain lawn and remain accessible to residents, but the other area of the ellipse will be fenced off and will be access for the promenade construction, which is area C, which is existing promenade and lobby areas will be closed sometime in June, when the pre-construction elements of all that will happen, and we'll see some construction walls go up in the lobby of the tower, and that whole section of the ellipse will be closed to resident access. And then D, way off to the right, is the temporary lot that I shared with you, where we're going to put staff during the period when the Parsons lot, which is Area E, is under construction. So I hope that's helpful in your understanding of the elements of the project that are coming in the next couple of months. It's really important that we get these elements of the project completed first, so that we have a place to put all the cars during construction when we get to the expansion elements, and we keep this campus as safe as we can during all of that time. So doing this first, getting it finished before we start the next phase is really critical, and the bulk of that can happen through the remainder of this year, and get this part of it behind us. Lastly, just a quick reminder that the accounting offices that are downstairs by the fitness center, between the bank and the fitness center, that staff are all moving to the pavilion second floor area next week. Russell Gardner, our CFO, and his assistant, Victoria Reese, they are not going to pavilion. They are going to the hallway down near Avalon, where Kathy Morton's office is. They're moving down there so that they'll have access to the community, a little better access to the community. The other thing that's important to remember is all the phone numbers for the accounting team, whether they're going to Pavilion or they're going down to Avalon, remain the same, and so you can continue to get a hold of all of them through the same phone numbers and emails. Their office locations change, but nothing else changes. So that's a lot of information. I hope you found it helpful. That's all I have today. Jess Goldberg is up next to talk to you about package management. Jess.
Thank you, John. As John said, I'm Jess Goldberg, the Courtesy Services Manager. And today I'm excited to introduce a process that's a secure way to speed up package delivery for many residents. Westminster Canterbury independent living residents receive about 1,000 packages a month. We see this number rising, and we anticipate a further rise as ordering from the internet becomes routine for more of us. I'm here today to introduce you to a technology that we believe will help speed up this delivery for independent living residents. At the end of June, package lockers will be installed at the tower and the center. These lockers will be in use starting July 1st. Package lockers are secure, and once you get a package, you will receive an email letting you know that your package has arrived. You will no longer need to visit the front desk to retrieve your package. Instead, you will pick up your package at a locker with a code that arrives in your email. We will also be able to assist residents without email. This is the first time you're hearing about package lockers, and we will have more to share soon. We will provide plenty of instruction and additional information before we begin to use package lockers. In the coming weeks, we will publish times when you'll be able to come down and learn more about the lockers. We will also share an introductory video with you to show you how the lockers work. I'm really excited to introduce a process that's a very secure way to speed up package delivery for many residents. Thank you, and I'll have more to share soon. Next up is Vanessa Perry with Pastoral Care.
Good afternoon, everyone. We know many of you that receive our monthly daily prayer booklets have requested to have a copy of our service bulletins. So starting next week, on Tuesday afternoons, the Thursday morning service bulletins will be at the center desk and the tower desk. So if you need to have a copy, you would like to follow along as you watch on TV 970, they will be available starting next week. And please check today's issue of the Westminster Canterbury Tales for announcements about upcoming pastoral care programming. I will now read excerpts from the poem, Endings and New Beginnings. The time we all spent has come to an end. The things we know will become our past, but the things we do will guide us into the future. We will make a path towards a brighter destination. The path holds many things we hold dear to us: the experience of growth, the feelings we gained, the friends we met, may they be old or new. The result of blossoming love, having our hearts broken, repairing or building relationships, death of precious people we cherished. Although we don't know what's ahead, we know it will hold great and bad fortune because it's something we don't know. That's what makes it fun to not know what's ahead. We will see the new beginnings of life. Endings won't separate us, only death can. However, let's say goodbye to an old year and let's welcome the new one. What lies up ahead may be a mystery, but we must welcome it. Let us pray. Heavenly Father, we thank you for bringing us into this beautiful new day. We thank you for seeing us through the tough times, both here and in our separate households. We look forward to all that life will bring us, both the comfortable and the uncomfortable. We know every circumstance and every conversation will help mold us and shape us into the people you want us to be, loving, caring, and considerate of one another. We ask your blessings on the new chapters here at Westminster Canterbury. May the staff and contractors work together to shape our new era of life and growth here, while still honoring and not forgetting past accomplishments made. Let us always be ready to listen to one another and find that mutual bond that would hold us together as a community. I pray that only your will be done. As the poem just said, the things we know will become our past, but the things we do will guide us into the future. It is in your name that I pray. Amen. Please join us next week for our next update.